Hi, I'm Nancy. I'm 59 years old, and 7 weeks ago I had a total right hip replacement anterior approach with Dr. Bonenberger. Before surgery, I had hip problems for about 7 years, and it progressively got worse. What I couldn't do before surgery is I could do activities, but once I sat down and tried to get up after 10-15 minutes, I was stuck. I couldn't move. I had excruciating pain. I couldn't put any weight on my right foot. And then once 10 minutes passed by, 5 minutes, whatever, I could then walk, and the more I walked, the better it got, but that just happened more frequently. What made me decide to have the surgery is I went out to dinner with a retired doctor friend of mine, and he knew of my hip problems for the last 7 years, and would tell me to take a leave or whatever. And after dinner, I tried to get up out of the booth and I couldn't, and he was very alarmed. He looked at me and he said, "Nancy, it's time to have your surgery." And so I said, "Can you help me?" Because he knew a friend that had the anterior approach, and he was, as a doctor, he was just very, very impressed. And he said, "If you ever have to have your hip done, you need to go this way." So I asked him, I said, "Would you please research that for me and find me a doctor?" And he did, and he found me a good one. He found me Dr. Eric Bonenberger. I had surgery on March the 23rd, and I was in the hospital for 3 days. What was nice was that Dr. Bonenberger used some kind of epoxy, so I had no staples. I felt very comfortable. I had a little physical therapy in the hospital. They just walked me around the nurse's station, and I was, even the first night, my surgery was at 7 in the morning, and that night I was walking around. Came home. Within 12 days I was not using a walker or a cane. 4 days after surgery I walked 1/3 of a mile with my walker, and a week after surgery I was walking a mile. 3 weeks after surgery I was riding a bike with no pain, and felt real good about everything. I was very surprised at the incision size. It was only about 4 inches, and because he used the epoxy glue of some sort, I was able to shower as soon as I got home. The pain in the hospital was very tolerable. It wasn't anything compared to what it was before surgery. Once I was home, I had physical therapy at home for about 8 visits, and the physical therapist just was amazed at how advanced I was and what I was able to do because of the anterior approach. Since I was so mobile, I was able to go out and I'd walk around the block, and my neighbor would say, you know, why do you have your walker? And I'd say, well, I had surgery 5 days ago, a total hip replacement, and they just couldn't believe that I was walking and not in a rehab facility. Then I would go other places and people would just stop and talk with me and tell me all about their hip surgeries, their hip surgery was not the approach that I had. And they talked about how much pain they were in, how they had to be at a rehabilitation center for a few weeks, how they couldn't go upstairs, and they'd say, "Can you go upstairs?" And I said, "Well, I really haven't tried," but right after they said that, I could walk up and down the stairs with no problems and no therapy involved in that. I was just able to do it. One thing that I would like to relay to patients that are researching hip replacement is to do your research. Don't listen to your physician that says, we're going to do this approach, it's minimally invasive, and they don't really mean minimally invasive anterior approach. They just mean that their cut isn't 12 inches long. And I went to those doctors. I went to 3 doctors before finding Dr. Bonenberger, and they said, "I've been doing my surgery this way for 30 years. It works. I do a good job with it, and that's the way it's going to be, but it doesn't have to be that way. If you go with the anterior approach, there's less disturbance to the muscles around your new hip, and it is truly minimally invasive. It's the way to go.